I'm Alicia, a physical therapist with Associated Physicians Group. Many of our patients come to complete our knee program for pain associated with osteoarthritis of the knee. They first meet with a physical therapist for their initial evaluation to determine an individualized plan of care. Something that we frequently use is our Theraciser. This is utilizing a resistance band and a series of concentric to eccentric movements of the hip, knees, and ankle to accomplish some specific goals. Today, I'm here to talk about each phase and the goals of each phase to give you a better idea of why we're doing what we're doing. Phase 1 is a series of short arc movements performed at a slow speed. The goals of this phase are start to improving range of motion, to start working on the scar tissue formation, to start pumping out any excess fluid or swelling that's in the joint, and to really start helping getting the joint moving. So it would kind of look like this. You're going to start nice and slow and controlled, and just in the partial range of movement. Phase 2 is going to just be a progression from phase 1. You're still going to do a short arc movement performed at a high speed this time. So the point of the high speed is to really start getting a little proprioceptive feedback. We're trying to get full range of motion about the joint, so we want to eliminate any scar tissue formation that may have occurred. The movement that you're getting with this phase is going to start nourishing the health of the cartilage also. Phase 2 is going to look a little same motion, but nice and quick. You want to make sure that the patient is doing it in a controlled motion and free of pain. So we're going to go ahead. Phase 3 is an important phase because phase 3 is actually when we're starting to get into more of a functional state. So we're going to move about the full range of motion that the joint has at a slow speed. So this is going to look about like this, nice and slow and controlled. The goals of this phase are to start improving the range of motion again, to start improving endurance at the joint, to work on some flexibility, and to start working on your functional movement patterns. Phase 4, or the last phase, is going to be our very functional phase, and it's full range of motion performed at a high speed. So you want to do that. It's going to look about like this. Good. Nice and slow and controlled without pain. Some of the goals of this phase are to start improving proprioception, improving endurance, and to start really getting you back to the functional activities that you need to do, walking, performing sit-to-stand, climbing stairs, things like that.
I hope you enjoyed Alicia's segment on Theraciser physical therapy. It's a very important part of our program. We found over the years just how critical the Theraciser is to the 86% success rate of our alternative to knee replacement program. There are a few reasons for it. First and foremost, while it seems to start off very easy, it is intended to be like that. We don't want it to hurt, number one. Secondly, is that each session has a very specific role in the overall program, and every time you do the program, it builds on itself to make it most effective. The single most important portion of the Theraciser role in the alternative to knee replacement program is that it prepares the joint fluid so that the injections are maximally effective when done. The reason that it does this is as we get older, our joint fluid, which can be compared to engine oil in your car, behaves much the same way. As we get older, the joint fluid's viscosity or lubricating effect begins to diminish. When you receive a viscosupplementation injection, in our case Suparts, the less viscous or the more broken down the joint fluid, the less effective the injection will be. This is very important because the only way to successfully increase the viscosity or lubricating effect of your existing joint fluid is through a high-speed, pain-free motion. That's where Theraciser comes in. We do the Theraciser before the injection so that we rev up the joint fluid, make it more thick, make it more viscous and lubricating. Then when the injection, which we do under fluoroscopic guidance to ensure accuracy into the joint, the molecules of the Suparts bond with the molecules of the synovial joint fluid, and that bonding creates a chemical reaction that allows your body to produce brand new synovial cells that then produce brand new thick viscous joint fluid that lubricates and cushions your knees all over again. So therefore, if the joint fluid is not thick and viscous, and anybody with advanced osteoarthritis, your joint fluid is more like water, it won't work as well. So we do the Theraciser, then we do the injection. Results are spectacular. If you have any questions about our alternative to knee replacement program or our Theraciser therapy program, you're welcome to call Associated Physicians Group at 888-363-8333 at any time.